So hey everyone, my name is Tzvia Bader and I'm the CEO and co-founder of Trialjectory. So unlike the previous one, I actually hope that none of you will ever need to use my product. Unfortunately, statistically, it's probably not the case. With cancer on the rise, the majority in this room, including myself, have faced cancer or dealt with cancer with our loved one. This is me. 5 years ago, I was diagnosed with malignant melanoma, a deadly form of skin cancer. The odds were a little bit against me, but it was clear that a little cancer is not going to be in my way of actually enjoying my life and raising my girls. So I started the journey of fighting for my life. This is 19 years after I lost my mom to cancer. And what I found out is that the world of cancer and treatment in cancer has completely changed due to the advancement in science. And I found out that there is right now more than 100,000 oncology drugs that can actually save a lot of patient life. And I found out that those trials are now become standard of care and is recommended by the Bible of the oncologists called the NCCN as what to do when when you have cancer is go and look at the new advanced treatment. But unfortunately, there's no easy and smart way to find them. A, because of their volume. So we're talking about 100,000 running trials for just oncology. Huge volume we've never seen before. B, they're very complex. Obviously, immunotherapy, targeted therapy, different regimes, a lot of inclusion-exclusion criteria. They're looking for very specific DNA, talking about DNA mutation. They're looking for very specific patient profile for each of those trials. So how do we find them? What I found in my journey, that you talk to your oncologist and a lot of them are not familiar with all those trials. And how could they? Such huge volume, such complexity. They don't have the time, unfortunately, to actually seek out and do the research for you. Too many patients. And last and not least, I found that some of them have their own agenda. They have their own trials that they're promoting, their own hospital they're pushing on you. And it was shocking for me, as I'm sure everyone in this room, we live in the digital era. We all do almost everything online. We buy our houses, we book our flights. In an era of democratization of resources that we live in, and the most important fight, the fight for our life. There's no smart tools out there to help us actually take over. And I managed. I found the right trials for me, and obviously I'm here and healthy. And I decided that this is my quest. I'll use my know-how in technology, and I come from many years in the tech industry, and actually help remove the barriers. And this is what Trialjectory is all about. Trialjectory is a marketplace, if you would like, an AI-based that helps remove the barriers between the patient, community oncologist, and a pharmaceutical company. We help bridge the gap of the complexity of the clinical trials criteria, the complexity of the medical lingo, and bridge it and make it available to patients and their oncologists alike to find those relevant trials for them. In this way, we also help the pharmaceutical company. Pharmaceutical company investing billions of dollars. We're talking about $38 billion R&D spend on developing those new drugs, and unfortunately are suffering from lack of patient. Not because there aren't enough cancer patients, as we said, but because they don't know how to get to them. 90% of the clinical trials are at least 1 year behind. So do the calculation of not only the operating cost for it, the revenue loss, we're talking about $1 billion revenue yearly for new oncology drugs, but also the life that are lost because the drugs is not being pushed forward. 30% of phase 3 trials, phase 3 is when we know the active ingredient is working, are closing due to enrollment issue. So again, they're looking for those patients. They can't find it because the majority of the patients are being treated in the community oncologist. The community oncologist cannot recommend clinical trials because they don't know how to find them. Patients who are looking online in Google's and other places can't find the right clinical trials and are getting lost. You've probably seen in New York advertising lately for clinical trial, which is awkward for patients being tracked in subway and being identified as a potential for clinical trial. So how we do it? Why do we need technology to do it? And how can technology basically mimic the mind of the best oncologists in the world? We take the entire data of the clinical trial description. It's all, the FDA had done a great job in putting it all in one big database. Unfortunately, it's completely unstructured. So we have like 20, 30 pages of Words document describing the clinical trials, describing inclusion, exclusion criteria. We run it through our own unsupervised NLP that basically take keywords to say the machine is learning it, and it's a she, the machine, because she's smart, and basically identifying it, understanding it, and structuring it, building our own taxonomy. Once we created our taxonomy, we start clustering it to different inclusion criteria around your history of treatment, side effects, genetic mutation, biomarkers, etc. We take all of that, and from that we're generating automatically a questionnaire, a dynamic questionnaire. So we reach out to the patient or their oncologist and we ask them about their disease, about their prognosis, about their treatment, about the side effect. And trust me, every patient can tell you all about it in their sleep. Think about yourself and your career path that you manage. Can you talk about your CV in a heartbeat? Yes, you can. Same goes for patients who are running this journey of their life. Once they go through our questionnaire, and it's pretty relatively quick for them online, we run the match and we match them to the clinical trials that exactly fit the profile that they currently have. Their medical profile fit the clinical profile of the clinical trials. And then instead of getting lost in a matter of 5 minutes for free, a patient has a list that is very concise, very relevant of trials that could help save his life, that is relevant for him. He can then reach out with us to the trials lead and learn more about it. He can discuss it with his oncologist and then decide what he wants to do next. And we're basically giving him options. And that's what it's all about. We're a team that combines, obviously, data scientists, techies, UX guy to make it easier, and most importantly, cancer researcher. One of them stands here, and an oncologist. I think what's important for us, that like we said, cancer is impacting practically everyone, unfortunately. And I think accessibility to advanced treatment cannot be the right of just the privileged one, who can afford the best of care, that can go to the best of hospitals, or who hire a consultant to do the work that machine can do for them, do it themselves. So this is what we're about, and we're here to save life.
Okay, I'm so glad that you're here with us today to give that presentation. That was amazing. The technology. So how much of it do you actually have built? Or are you asking for money to build it?
No, so we build the majority of the machine is existing and working. We started with an MVP that was bootstrapped because it was a mission of ours and there was a lot of question mark. Take my scientist here. Whether we can build a machine that will do what oncologist does, because it's so complex, because it's not trivial. So we started bootstrapping it. And we took melanoma as a small indication, and we wanted to see if we can make it work. And we did, and it worked, and we launched it beginning of June, I would say. And we just, and we're teaching, so the engine exists, and we're teaching him disease, cancer type by cancer type. We just launched 3 weeks ago CRC, which is colon and rectal cancer, third largest in the US, that now impact more youngs than ever before. And we're already in the process of introducing or teaching the machine, and because it had to learn each disease, the terminology, the pathologically, breast cancer that should be launching in the next 3 months. So we have already, in terms of patient profile, we have, I would say, over 2,500 more or less. We have new, unfortunately, but I'm glad we're there for them, around 50 new patients daily that are coming and finding us via just social groups, discussion in Facebooks and other. So.
Can you tell us a little bit about how you charge and who pays for this?
Okay, excellent. So as a mission statement, we don't charge patient because I don't believe we need to charge patient. There is an industry here that makes a lot of money. So our first revenue strategy is pharmaceutical company who are paying right now for enrollment. It's very similar to the enterprise placement industry. So they're paying manual recruiter who actually buy database of patient and reach out and ask them if they're willing to participate. And the fee goes from $1,000 to $8,000 per patient. We believe that we be able to take premium prices because we're doing a very accurate job in terms of already doing all the fitting for them, so they don't need to do additional screening other than the ones that they need updated results, but they don't have to start from scratch and interview the patient and ask for all their data, etc. So that's our patient per fee per patient, strategy. And from there, we will grow to a more SaaS model, like a monthly recurring fee. And by giving the app to community oncologists as well as something to maintain and grow with. So that will be the revenue stream.
Thank you.
Of course. Just to let you know, already they're paying around, $6 billion just for the recruitment. That's what they're paying now on a recruiting fee. It goes to the manual recruiters, it goes to the advertising that you see in here in and subways and in Facebook. Well, those of us that discuss cancer on Facebook are being targeted nonstop, which is insane because it also creates expectation and hope, and irrelevant sometimes. So,
Thank you.
thank you guys.
So great.
Good.
Thank you so much.
Thank you.